Hi guys. So I wanted to come on here. I had a doctor's appointment yesterday and I didn't expect a whole lot out of it. I thought I was just gonna go in and get weighed and let them know that something's been going on lately with my lower back. I've been having like a shooting pain. I nearly collapsed twice last week. Once was on Monday while I was making dinner, I believe. We were doing spaghetti, and I turned around to get something, and I nearly hit the floor. My knees just gave out from under me. And it wasn't like a numbness or like a pain or anything. It was just like my lower back just hurt more than usual, and it was just a shooting pain, and I went down basically. So I wanted to come on here and I wanted to show you guys some stuff that's going on with me, just to kind of give you a heads up that my weight may or may not be affected with my diet. I do have some stuff pre-made for my detox, which started today. And FYI, this stuff is absolutely disgusting. I hate vinegar. I hate the smell of vinegar. I hate the acidic taste of vinegar. So I have my detox tea, and I'm going to go to the store today. I got to pick up something anyway. And I'm going to see if they have anything else that's detox that I can drink that doesn't have vinegar in it. So I tried. Um, it's disgusting and my throat is still burning, and that was like 30 minutes ago. So I went to the doctor's office and let me get my weigh-ins first at the doctor's office so I can go through that with you. Hopefully that shows up. Oh, no, stop that. I hate it when you move something and it just like that. So I have my doctor's paperwork right here in front of me. My blood pressure was 122 over 84. My height, as usual, I'm 5'8.5". My weight, they weighed me in at 248 pounds, which you're gonna go, oh my god, you've gained weight. No, I haven't gained weight. My doctor's scale is 5 pounds off from mine, and I've been keeping track of that. So, let me pull that up. Initial weigh-in on December 3rd at the doctor's visit was 279.2. And then I saw him again on the 16th. It was 267.6. And when it was 267.6, mine was 262.4. It's 5 pounds off. So I was 11.5 pounds down on their scale. I was 9.7 on mine. The doctor I went to on December 30th, it was 263.2, and my scale that morning said 257.8. That was 5.6 pounds off from my scale. So his said 16-pound loss, and mine said 14.4. Let's see, psychiatrist scale is close to mine. January 7th, the doctor's scale 263. Okay, I didn't go. I went to the psychiatrist that day. Hold on. I'm figuring it out. January 21st. The doctor's scale said 255.8. And mine said 250.2. So theirs was 23.4 pounds lost and mine was 22. So yesterday, which was February 25th, this video is going to be posted a couple days late. The doctor's scale said 248, which is a 31-pound loss on their scale, and mine said 243, which was a 29-pound loss on my scale. Now this morning I got on the scale, it said 241.6, so that's 30.4 pounds lost on my scale. So it's still showing progressively losing weight. It's close that out. And describing the back pain and everything that I had. He diagnosed me with radi radiculopathy something, basically pinched nerve. That's the big fancy word for pinched nerve. As you can see, yesterday, the 25th, 2020. Those are all my other issues I have with like my back and my ears and everything else and whatever. Yes, I have a million issues. That's my doctor printout sheet they give me. They give this to me every time I go to the doctor. My printout sheet. I get everything, my list of medications I've been on, everything. So, naturally, he wanted to know what's going on with my back, if it's getting worse or whatever. So he sent me in to do x-rays, which there was a place down the street that does walk-in x-rays. So I went and did x-rays. Oh, I didn't pull up a picture of my spine to show you guys. Alright, so this is my spine. As wretched as that looks. As you can see, these are your S1 joints, your hip joints, and as you can see, I have really no space where they're supposed to. They're pushing down on each other. This has probably gotten worse. As you can see, this is a lot wider and this is a lot more narrow. This is the S1 that they're talking about in a second when they did my x-rays and diagnosed me with another issue. This is my L5, my L4, my L3, my L2. My entire lower lumbar is all compacted. I have like no disc space in between any of them. I have degenerative disc. As you can see, there's healthy disc space between these, along with my scoliosis. But there's nothing there in my lower back. It's just all crunched down. And that's a birth defect. My L5 never connected to my S1 like it was supposed to. Story of my life. So the doctor told me to go get x-rays. I went over to their building and, oh, that's hard to see. That's teeny tiny. Well, I have that paperwork right here. It says you saw such and such doctor on Tuesday, February 25th, 2020. The following issues were addressed: spondylolisthesis at the L5S1 level, sacroiliac joint dysfunction, that's your S1 of the right and left side, chronic bilateral lower back pain, unspecified whether sciatica is present. That was the visit why I was there. I didn't know if I had a pinched nerve. The doctor wanted to double check. That's why it says unspecified. My BMI, they said patient instructions and education below. So my BMI, they marked me at 37.6. I don't know if I'm at 37.6. Let me get my weight tracker. This thing says my BMI is 36.4. So their BMI calculation doesn't match my BMI calculation. Maybe they took that off of my paper. Good question. Because I had BMI 37.0 to 0.9 back in 2018. It was pretty high. And I know I'm not that anymore. Blood pressure was 121/89, pulse was 96, and he said based on the x-rays, it is showing that I do have S1 joint dysfunction on both sides, and my L5 is slipping, which is causing that pressure on the nerves that go to the legs. So I wanted to show you what the pinched nerve basically is. What the first doctor, my primary, diagnosed was the lumbar thing. I can't pronounce it because whatever. Refers to disease involving the lumbar spinal nerve root. Can manifest as pain, numbness, or weakness of the buttock and leg. Sciatica is a term used by lay people. Lumbar is typically caused by compression of the spinal nerve root. Well, that's obvious that I have compression of the spinal nerve root. I didn't get any images of my x-ray. Hopefully the doctor next week, I have to go in for a checkup, a follow-up. Hopefully I can see the x-rays next week and get a picture of that. That would be great. But basically all of these spinal pieces crunch down, and they cut off the nerves and stuff. The other one is the S1 joint dysfunction. Is improper movement of the joints at the bottom of the spine that connect to the sacrum to the pelvis. It can result in pain in the lower back and legs or inflammation of the joints. I probably have inflammation. I have 2 types of arthritis already. Let's see. Okay, so that's what I was saying. That's pop-ups. That's what I was saying about my spine. If I can put this side by side. Stop. My spine, this is my S1 joints. And this is, they're supposed to go like this all the way up. You don't really see it up here at all. It just kind of like, it's right here, like halfway on this side. On this side you can see it all the way through, but it's kind of like pinched right here. So that's my S1 joints. And that was, like I said, this image is from 2008, so the compression could be worse now. I'm just basing it off of what x-rays I do have. So he gives me instructions. Ice the lumbar spine twice a day for 20 minutes. I have an ice pack, but I don't know how well that's going to work. Continue prednisone taper. That's the steroid pack that I was prescribed by my first doctor yesterday. And then the second doctor added Tylenol with codeine, 1 to 2 tabs for pain. Dispense 20 tablets. Patient is unable to take tramadol secondary to reaction with medications I am currently taking at this point. So he wanted to give me tramadol instead. But he said it would interfere with my other medications, and I was like, find something easier. And patient has essentially not gotten better on medications, she has failed physical therapy. I've been to physical therapy. That doesn't fix, I mean, it helped my muscles, but it doesn't fix my spinal pain and nerve pain. Sorry. Follow up with the doctor at the hospital. His name is written. I have an appointment March 5th with him at 10:20 a.m. For reevaluation and to consider possible injections. And I know I've had an injection, a needle in my back before. It's a temporary solution. It's just like a steroid pack. It really doesn't do anything. I need something else, and I may have to probably consider surgery on my S1, which is not a pretty sight. This is my medication paperwork. I have to turn this in today for the codeine. I also have to pick up the steroid pack and everything else today, so that's going to be a CVS day for me. What else haven't I covered? I just wanted to kind of cover everything. My primary care doctor They didn't get my Doppler results. That, if you guys remember, I did the Doppler on my legs and my arms for blood pressure to make sure that they're going to my extremities. I went to the hospital for that to get that done, and that was back in December, like December 16th or something like that. I never got those results. The primary doctor is claiming they never got the results, so they wrote on here, get Doppler results from CJW as plan of care. So next week when I go in for my follow-up, hopefully I have my Doppler results. That's why I haven't updated anybody with those. I haven't seen them. I haven't heard of them. I have no clue. Continue meds as noted. Today's diagnosis, lab and chart, has been reviewed. Avoid, I have specific medication. I can't take a leave or Advil or anything with the medication, the meloxicam that I take. Cool compresses, moist heat, warm up stretches. Let your pain dictate your activity. He told me I was standing too long. I'm not sure how I'm standing too long. I was making dinner. Maybe dinner took longer than I thought it was to make. But he said that's what was causing me to collapse, was I was standing too long, and I was basically cutting off the circulation with the nerves and stuff to my legs, and that was the shooting pain and me falling. Continue with activity, lifestyle, no added salt, keep up good effort, no added sugar diet, keep up good effort, low cholesterol, low fat diet, keep up good effort. Patient and or family understands, they have no further questions. Discussed treatment, blah, blah, blah. That's scary looking. Why did that pop up? Aside from all that, I mean, I'm trying to figure out what's going on. They said my L5 was slipping more. Possibly. I don't know if they compared it to old charts or whatever, but I need it compared to old charts. Your L5, I have something called spondylolisthesis. I don't know if you know what that big word is. But basically, it's a condition where the lower vertebrae, it's a disease of the lower vertebrae. It slips forward onto the bone directly beneath it, like the disc basically disappears. Well, I don't have discs in my bottom few. As you can see here, it's supposed to be a normal spine. Let's see if maybe one of these has a better image. So here you have normal spine. You got the discs in between. I don't have these. I don't have discs in between any of those. And then spondylosis is when the top part, the back of your vertebrae touch or whatever. Well, spondylolisthesis is when it like completely disconnects. Well, I don't have this on my L5. This part right here that's supposed to connect, I don't have that. All that right there was never formed. And that's why it's a birth defect. It was never formed. And mine is slipping. So since I don't have these discs right here, this actually is lower and all of this is compacted. So all of these bones are actually touching each other, which is cutting off where your nerves are that go right through here. This is your nerve root. It's cutting all those nerves off. And then it has to go through the S1 where the nerves go to your legs. So that's basically what my spine is doing right now. And it has been doing. See, that's a par fracture. That's what mine is. It's kind of doing. Mine actually is lower than that. Mine is like right here almost. I used to have a side-facing x-ray, but I don't know where it went. I can't find that image anymore. Hopefully, like I said, I can get others. There is a surgical procedure you can do with the rods and pins. I don't know what all they can do with my spine, even if I opted for surgery, because I also have the scoliosis. I mean, they would literally have to straighten over half my back and pull it out and put the disc spacer things that they have in the fake discs or whatever, and the rods and pins, and then they'd have to do the S1. They'd have to put the rods in the S1, and I'd basically be like, I don't know, half robot by then, I guess. But that's my update. They put me on a steroid pack. I have to start that today. Today is Wednesday, the 26th. And that's for a week. I have to go back on, what does my phone say? My calendar. I have to go back to my primary doctor on Monday the 2nd, and then I have to go to the hospital doctor for more x-rays and stuff like that on the 5th, and that's going to be interesting. And then I don't see my primary doctor again until the 23rd of March. And hopefully by then, I have some sort of answer as to what my spine's looking like. Hopefully I can actually see it and see what's going on. I'm better with a visual myself. I don't know about anybody else, but I'm better with a visual. And that's about it. I just wanted to update you guys to let you know that I am basically bedbound for the next few days. Limited mobility. I can't stand for probably like 5 to 10 minutes at a time. Unfortunately, there's not a whole lot I can do. I get excruciating pain in my lower back when I'm grocery shopping. So it's pretty clear that I'm losing mobility there. The steroid pack usually works to decrease the inflammation and stuff like that. I've dealt with this multiple times. This isn't my first rodeo, It's not going to be my last. But now that I'm on this weight loss journey, I have a feeling, like, I'm afraid that the steroids are going to affect my hunger and stuff like that. It's going to affect me trying to detox this week. It's going to affect my diet. It's going to affect everything. So I'm kind of worried about that. And the pain meds. The pain meds are supposed to actually be, it's codeine. And all pain meds make you drowsy, so I'm going to take those at night, hopefully. I don't know what's going on. But there's my update on that. So I guess just keep me in your thoughts, and I will keep you guys updated on me. Thanks for tuning in. I really appreciate it, and smash that thumbs up on your way out, even if you didn't like the prognosis or whatever diagnoses that I've got. And leave a comment if you've dealt with, I guess, surgery or anything on your spine. If you know anything about spondylolisthesis, scoliosis, S1, dysfunction, all that sciatica stuff, what works for you? Because I've tried physical therapy, they tried the heat compresses, they tried the electric thingies on my, like I said, that's all for muscle. Like, it has nothing to do with my spine still hurting when I leave the building. I guess just leave a comment and let me know what works for you. Maybe it'll work for me too. We'll catch you guys in another video. Thank you for tuning in. Bye bye.